When would you advise to opt for MHT? We have a question that's submitted that the person is extremely worried about brain fog.
Yes, and this is something that I get very frustrated about when we are looking at the rhetoric that is going around about menopause hormone therapy, that every woman should be on it to counter dementia, brain fog, cardiovascular risk factors. When in fact, we look at the guidelines and there is no efficacy for this. We see that women should be using menopause hormone therapy for attenuating all the menopausal symptoms. We also see that it can be very beneficial for slowing the rate of bone mineral density
Mhm.
loss, so it can be used for osteoporosis and osteopenia, but there is nothing there to show that it can help with dementia and brain fog. When we're looking at changes in brain volume and brain architect, we do see that women who have a particular gene, the APOE, they do benefit from using menopause hormone therapy, but all other women don't with regards to brain and brain health. We do see from exercise that we can have really significant brain changes in a positive way that can help with brain fog. It can help with cognitive function, attenuating cognitive decline. And I don't mean just walking, which I think people out there are saying, yeah, a lot of the other doctors are saying MHT and exercise, but they're not being specific of what that exercise is. So we have to look at the type of resistance training and the type of intensity.
Mhm.
And I say this from women who are already training and looking for extra help. I'm not talking about someone who has never exercised before, because you have to be willing to challenge yourself. And women who are already exercising already have that intrinsic motivation for that challenge. So you can mix them, but you have to be specific of why you're using the menopause hormone therapy and try not to buy into the circulating rhetoric going around that every woman needs to be on it to stop dementia, brain fog, and cardiovascular risk factors, because the evidence is not there for that.